Histohoppers.
British Medicine Through Time, Modern Medicine, 1900 to Present, Part 1. In this video, we'll cover causes of disease, prevention and treatment, which includes diagnosis and antibiotics.
Important. The two C's, continuity and change. There will always be questions asking you to compare time periods, so make sure in each video you listen out for words to do with continuation or change.
Causes. Lifestyle. We now have much better understanding of how lifestyle choices affect our body and how they link to disease. Smoking. Doctors have linked smoking to a variety of conditions, most commonly lung cancer. They also now recognise smoking is associated with high blood pressure, heart disease, throat and mouth cancer, and gum disease or tooth decay. Even secondhand smoke increases asthma cases amongst children. Diet. Diet has a huge impact on health, something they did know in the Middle Ages. Sugar and fat are the biggest concerns, as too much sugar can cause type 2 diabetes, which is incurable. Too much fat can lead to heart disease. Drinking alcohol and drug taking leads to liver and kidney disease. The use of needles can spread disease, like HIV. Other factors that can impact your health are STDs, poverty, stress, and exercise. Genetics and DNA. In the 1900s, it was clear that microbes didn't cause all disease, and some conditions we are born with, but this couldn't be identified at first, although they knew the link must be there, especially in hereditary diseases, which are passed down. Early work on genetics theorised that genes are inherited from each parent, but it wasn't until the development of the electron microscope in 1931 that genes could be seen. And still, even by 1950, the missing piece to their puzzle hadn't been found. It took a series of discoveries to find DNA, beginning with the late 1800s when scientists knew DNA existed and that it controlled what we are like. The vast improvements in science and technology of the 1900s allowed scientists to make the first photo of human cells and then work out that every cell in the human body contained DNA. In 1953, two scientists, Francis Crick and James Watson, discovered the structure of DNA. They also proved DNA was in every human cell and was passed down from parents to children through their genes. They then worked with Rosalind Franklin, who developed the technique to photograph DNA, and she was the first person to X-ray photo DNA. The Human Genome Project. In 1986, scientists began to identify the purpose of each gene in the human body, completing a map in 2001. Mapping DNA was vital to helping scientists understand the causes of genetic diseases. Scientists could use the blueprint of human DNA to look for mistakes or mismatches in the DNA of people suffering from hereditary diseases. Scientists have now been able to identify a gene that's sometimes present in women who suffer from breast cancer. DNA and causes. Germ theory only helped identify bacterial causes of disease. Doctors can now identify genetic causes of disease that have been inherited from the sufferer's genes. It would also let them work out how to help sufferers and prevent these diseases in the future. The importance of the discovery of DNA. The DNA discovery and its impact on medicine is still ongoing, and we don't know where it will take us. It may be the most important breakthrough of all time. It helps with treatment, as gene therapy can now help sufferers of diseases like sickle cell anemia. It helps with prevention also, as doctors can now screen for genetic diseases. Some can be offered treatments, for example those with hereditary traits for breast cancer, who can be offered a mastectomy to remove the tissue to prevent cancer. Prevention. The government has now taken significant action to improve public health since the 1900s. There are two reasons for this. There's an increased understanding of causes of disease, as well as an increased understanding of methods of prevention. Once the causes of some diseases are understood, the government can introduce new methods of prevention, such as compulsory vaccination. This was campaigned for measles, polio, and diphtheria. Screening for genetic diseases is now available, such as testing genes for breast cancer. The government also communicate health risks. During times of global epidemics, the government tracks travellers and puts quarantine measures in place. They also communicate risks and believe that this is now key in preventing disease. There are also charities such as the British Heart Foundation who create adverts asking people to protect their hearts. The first national vaccination campaign against diphtheria was launched in 1942. Over 3,000 children died a year from diphtheria, so in World War II the government finally took control. Children were now immunised and diphtheria died out. Other significant vaccination campaigns include those against the contagious disease polio. The first vaccination was introduced by 1956 and there's not been a case of polio since 1984. Key vaccinations have been introduced ever since, such as 1961 tetanus, 1968 measles, and 1970 against rubella. The government has also introduced vaccines like HPV, which protects women against an STD that can cause cervical cancer. Some viruses, like the flu, need a vaccine every year. The main concern is that parents are free to decline to have their children vaccinated against certain diseases. Government legislation. The government began to pass laws to provide a healthy environment for the population, such as the Clean Air Act in 1956 and 1968. These passed due to bad smog, which is heavy fog pollution in London caused by burning coal. The law aimed to reduce air pollution. Other recent government acts have included the smoking ban inside all public buildings, which passed in 2007. Also, the Limiting Car Emissions Act, which taxed cars that cause more pollution. There are also lifestyle campaigns. The government aimed to help people prevent diseases like cancer, heart disease, and HIV or AIDS by promoting healthier lifestyles, including advertising campaigns which warn against the dangers of smoking, binge drinking, drug use, and unprotected sex. Stoptober encourages people to not smoke for 1 month. Sugar Smart and 5 a Day encourage families to eat well and exercise. And everyone over the age of 40 is given the opportunity to have a health check every 5 years, which focuses on blood pressure, weight, and cholesterol levels, and it also includes lifestyle advice. Treatment. Science and technology have vastly improved the opportunities to test and diagnose. The benefits of this improved diagnosis have been that doctors can now treat patients using more specific treatment to their disease, whilst other instruments can be used at home by patients to monitor their illnesses. Blood tests and biopsies. From the 1930s, doctors could use blood tests to test for a huge range of conditions, such as anemia, whilst a biopsy, which is a sample of human tissue, can be used to identify diseases. The use of blood sugar monitoring allows those with diabetes to check their blood sugar levels to keep on top of their condition. CT scans. These are advanced X-ray machines which can be used to diagnose tumours and other growths. MRI scans use magnets and radio waves that doctors can create an internal image of the body with. This can be used to diagnose soft tissue or ligament damage. Endoscopes. These are small, thin, flexible cameras which are used to see inside the human body. They are used to look at digestive problems and can take biopsy of human tissue to test. X-rays. From the 1890s, these helped see inside the human body without cutting into it. They help diagnose broken bones. ECGs. Echocardiograms use electric impulses to track heart activity. These are useful after a patient has had a heart attack. Ultrasounds. Also known as sonograms, they use sound waves to build up a picture of the inside of the body. They can help diagnose kidney or gallstones, as well as keep up to date with the pregnancy. Antibiotics. In the late 19th century, more microbes responsible for specific diseases were being discovered due to Koch proving germ theory. This meant that vaccines could be made. The hunt was on to make artificial or chemical antibodies that would attack the infection without harming the body. The first magic bullet, Salvarsan 606. Paul Ehrlich, who worked with Koch, reasoned that if certain dyes could stain bacteria, perhaps certain chemicals could kill them. Ehrlich said this would be like a magic bullet. The chemical would shoot the infection, not the patient. He set up a private laboratory and a team of scientists, and by 1914 they had discovered several magic bullets, which were compounds, chemical mixtures, that would target and kill specific bacteria. The most effective and well-known compound was Salvarsan 606. It could be used to treat the STD syphilis. It was the first treatment of a disease using chemicals. This was a major step in the progress of medicine, as it was the first chemical that could be used to kill an infection inside the body. As a result, the hunt was on for better antibiotics. But Salvarsan 606 was made from arsenic, so it was also poisonous. The second magic bullet, Prontosil. In 1932, Gerhard Damack found the second magic bullet after years of research. It was a red dye called Prontosil, which killed the bacteria causing blood poisoning. First, he trialled it on mice, which proved to be a success. He then trialled it on his daughter, who had blood poisoning which couldn't be cured. He injected her with the dye and she recovered. Doctors discovered that sulfonamide was the key ingredient which attacked disease and were able to then create new drugs which cured gonorrhea, pneumonia and scarlet fever. This helped mothers dying from postnatal infection drop from 20% to 5%, which was a huge impact. Penicillin. The most important antibiotic discovered was penicillin. It was the first antibiotic made using microbes and not chemicals. Alexander Fleming accidentally discovered penicillin after leaving petri dishes with bacteria on, and then noticed the mould that grew killed the bacteria. He then diluted this penicillin and found it killed bacteria, but only on the outside of the body and not the inside. In 1938, two Oxford scientists, Florey and Chain, managed to create a pure penicillin which could kill bacteria inside the body, like septicemia. During World War II, the US government funded and mass-produced penicillin so that it could be used by the army, which was over 2.3 million doses. The NHS made it free for all, and it became an important wonder drug to treat and prevent illness. The impact of antibiotics. For the first time in history, doctors could now treat bacteria-based diseases, for example pneumonia, and deaths by the disease significantly dropped from the 1940s onwards. Work on antibiotics didn't stop, using other fungi to create more. As a result, streptomycin was discovered in 1943, an antibiotic so powerful it cured TB, which was previously thought incurable. In the shorter term, antibiotics had been a miracle cure, but in the long term, superbugs like MRSA are becoming resistant or immune to antibiotics, which proves continuing problems for scientists. For example, septicemia, which is blood poisoning, is fighting off old antibiotics. Part 2, we will cover treatment in the modern age, care in hospitals, lung cancer as a case study, and the progress.
The end. Thanks for watching, and remember to like and subscribe.